The shingles rash typically looks like this, and everyone will tell you about how painful this condition can be. Have you ever had chickenpox at some point in your life? Well, I've had chickenpox, and that means at some stage in my life I may go on to develop shingles. I've made this video today because I wanted to go through the best treatment options for shingles, how to stop it coming back, and what you need to look out for if you're worried you have shingles. What is shingles? Shingles is a viral infection that can cause a severe rash and discomfort. Shingles is caused by the chickenpox virus, which is also called. So once you've had chickenpox in your life, this virus stays in your symptoms, and when this virus is stimulated, it could lead to shingles. This virus can lead to havoc in your body. It can lead to painful outbreaks. So what can trigger the outbreaks? The outbreaks usually occur when your immune system is lower than usual. So you might be battling an infection, or you might have medication which lower your immune system. As the Herpes Zoster virus reactivates, it can manifest as shingles. This leads to some very specific and distinctive symptoms. It will generally lead to localized pain and a rash in a specific pattern. You'll usually notice small groups of lumps in a line-type fashion, and this typically follows the way a nerve moves through the skin. And one useful clue to remember is it does not cross your midline, so it doesn't spread from one side to the other side. It will stay in that dermatome, or that area that virus has been activated. Anyone can develop shingles, but generally much more common as we get older. And if we're older or we have a compromised immune system, the impact of shingles can be much more severe. Where can you get shingles? With shingles, it can be anywhere you have skin in your body, so that includes your face, your abdomen, your legs, even in your scalp. Usually the first symptoms you'll notice is just a burning type sensation. This is usually a nerve pain as it's getting activated. Then you might feel fluey or feverish, a little bit unwell, and then within around 1 to 3 days, you'll start getting the eruption of the rash. So burning sensation on your skin, then you might feel fluey, and then you get the rash. That's the typical pattern. Obviously 1 to 3 days is just a general timeline, because if you're immunocompromised or you're really unwell or your immune system is really run down, this pattern might be a lot faster. With this rash, you'll often notice the rash is umbilicated. So you'll notice a little dot in the middle, and that's because it's typically arising around a hair follicle. Then the blisters generally develop pus, and it can start to crust over time. An additional clue is if you get raised lymph node, and this is because your immune system is activated. So for example, if you have a rash on your legs or your torso, you might notice some raised lymph nodes in your groin area, or you might notice raised lymph nodes in your armpit area if you've got the rash on your chest. How long does the rash last? Well, the rash will generally last between 2 and 3 weeks if you're a young, fit adult, or 3 to 4 weeks if you're an older adult, as your immune system is a little bit weaker. Obviously, if you've got underlying health problems, like you're on cancer treatment or you're taking immunosuppressants, then the rash could last a lot longer, and you might need additional support for the rash to go away. Is chickenpox contagious? Well, the truth is chickenpox is contagious. Is shingles contagious? Well, the truth is that shingles can be contagious. So if you come into contact with someone who's never had chickenpox, you could give them the varicella virus, which could lead to chickenpox. So the summary is, when you have shingles, if you pass on the virus that causes the shingles, varicella zoster, and the other person has never had chickenpox or been vaccinated, they may develop chickenpox. I remember recently seeing a patient who was quite elderly, in her 70s, and had never had chickenpox or the vaccine. She went to see a friend who'd noticed a new rash on her arm but didn't know what it was, so she touched the rash. That rash turned out to be shingles, and as this lady had never had chickenpox, she went on to develop chickenpox. Obviously at age 70, it can be much more severe than if we'd had the rash in our youth. She told me that she regretted not having the chickenpox vaccine. How do you know when you're no longer contagious? Well, when you notice the blisters have crusted over, so are all covered, then you're no longer contagious. So remember, that's not just one blister is crusted over, when they're all crusted over. Important symptoms to watch out for. If you're developing a new rash and it's painful and tingling and you think you might have shingles, it's important to get medical attention straight away if you're pregnant, immunocompromised, or it's involving parts of your face or your eye. Additionally, if you have a young child which is less than 3 months old, complications of shingles. Most people who have shingles recover completely and don't go on to have additional problems, but it can sometimes cause symptoms called Ramsay Hunt syndrome. This is a rare condition where the shingles virus affects one part of the face. With this condition, you may end up with weakness on one side of your face or sometimes hearing problems as a result of the condition. Scarring or changes in your skin, muscle weakness, eye problems, the rash itself becoming infected. So symptoms you should be watching out for is if the skin becomes red, hot, warm, and you're worried you've developed an infection on top of the shingles. Or another complication which I've seen is post-herpetic neuralgia. This is when you recover from the shingles, but you go on to have pain for months afterwards. Post-herpetic neuralgia can lead to a constant burning sensation. A lot of my patients who have developed this condition tell me how difficult the burning and pain is to manage. How to get rid of shingles? Well, generally most people go on to recover on their own. They might feel a bit uncomfortable, but most people will just go about their normal routine and will just keep that area nice and covered up and clean. A lot of people will just feel fine apart from when they touch the area that has got shingles. My top tips for when you have shingles is keep the area covered up. You might want to put some Vaseline on that area and cover that area with a bandage. That can help keep that area nice and protected. Take over-the-counter pain relief if you're having a lot of discomfort to help you with your symptoms. You should really try to wear loose and baggy clothes so that area is not getting rubbed up by too many tight clothes. So if it's on your leg, then make sure you're wearing baggy trousers. If it's on your chest, make sure you're wearing a loose top so you're avoiding excess friction and reducing the chances of getting an infection. Number 4, you might want to try a soothing oatmeal bath, and this can be hydrating for the skin and help you with the burning sensations. What medication can a doctor give you? Well, with my patients, if they present with a rash in the first 1 to 3 days, in some cases, I consider an antiviral medication like acyclovir. This medication aims to reduce the amount of time that you have shingles and help reduce the amount of pain you get during the shingles episode. When to get medical attention? I've already explained earlier in the video, if you're immunocompromised or pregnant or it's affecting your face, it's really important to see a doctor as soon as possible. However, if you've seen a doctor and they've told you have shingles and you're managing your symptoms, there's important signs you need to watch out for in regards to when you need to get more medical attention. If you notice you're getting dizzy or confused or feeling quite sensitive to light, this could be a more severe infection. You've noticed your eyes turned red or it's affecting your vision, or you're noticing a blistering rash is continuing to spread. Obviously remember that complications with shingles are rare and most people will recover smoothly, but those are the important signs to watch out for. How long to avoid school or work? If you have the rash and you can cover it up, you don't need to avoid school or work, but you need to check with your place. Remember, in your work or school, you may come across pregnant people or immunocompromised people, so they might advise you need to stay at home until you're recovered. If the blisters have scabbed over and are dried out, you are no longer contagious. Commonly asked questions: is there a link between vitamin D and shingles? Low levels of vitamin D is thought to increase the risk of developing shingles. So remember to take the right dose of vitamin D that's been recommended for you. How can I protect myself from getting shingles? Well, when vaccination is appropriate, it's one of the best ways of preventing yourself getting shingles or reducing the severity. Additionally, remember to manage a healthy lifestyle, manage your stress levels, and remember to try to avoid contact with people who have shingles. If I can ask for a favor, if you write a comment or share this video and click subscribe, it really helps my channel to keep growing and for me to keep producing high quality educational content. I can see that most of you are not subscribing, and it just helps my channel to keep growing when you do. Thank you.